Hi to you all, ciao a tutti. Welcome back to my channel, All's Made Easy. In today's video, I'm going to talk about the personal hygiene or Igiene Personale, as we know in the Italian language. If you are somebody that you are taking the course to become an OS, Operatore Socio-Sanitaria in Italy. On this channel, I do explain most of the concept and the subject that are very difficult to understand. I do explain them in English, some of the questions that mostly they ask during exams. So if today is your first time watching my video, subscribe, like and comment, and maybe if you are taking the course already and there are some subjects and some areas you would like me to help you, you just comment so that we will all learn together. So when we talk about the igiene personale or personal hygiene, I have a simple definition because there are so many definitions for this topic. Anybody can explain it in a way he or she wants. So I would say that igiene personale è la pulizia della persona per mantenere lo stato di benessere e prevenire alcune patologie infettive. So the cleaning of the person to maintain a state of well-being and also to prevent other pathologies or to prevent other skin or other diseases. So in taking the course, this is one of the most essential component of all. There are many important subjects, but the Igiene Personale is one of the most essential components that you need to learn and learn it very well and also understand it very well. So when it comes to the Igiene Personale, we are going to learn about the help and the care of the personal hygiene, cleanliness as a person's need. And also we are going to learn about the techniques and some of the products that we use for making the or use in performing the Igiene Personale. We are also going to talk about the techniques and also some of the products that we use during bathing, like the stretchers, the showers, the chairs, and all those kind of things. We are also going to learn about how to do the occupied and unoccupied bed. Making of the bed is also part of our task. If you are an us, it is part of your task. So you are going to learn how to make the bed, both occupied and also unoccupied bed. We are also going to learn about how to dress the person relating to self-sufficiency. When we say something about self-sufficiency, so we are also going to learn about the techniques and methods for dressing relation to self-sufficiency. When we say somebody is self-sufficient, that means the person does not need any extra help. The person is able to dress alone and do many things alone. So we are going to learn about how to dress relation to a person's self-sufficiency. There are some people who are self-sufficient, they can do everything. There are some people who are partially, and there are some people they can't do anything at all. So we are going to learn the techniques and the method of dressing all those people. We are also going to learn about the hygienic and also the sanitary procedures for the composition and transport of the body. If you are also in Italy, the hygienic procedures or the sanitary procedures of the composition of the body is part of your task, whether you work in the hospital or you work in the residential homes, as we normally know or commonly known as the casa de reposo. If you are there, it's it's part of your tax. That's the composition of the dead body. When somebody passes out, we need to perform our last hygiene. And also whether there are some tubes and other materials on the person, we need to take them out. And also we need to help the doctors and the nurses to perform some procedures before the body will be transported to the mortuary. So let's get started. So when we say the Igiene Personale, we have three main types of the Igiene Personale. We have totale, we have parziale, and we also have speciale. So when we say totale, we are going to do we are going to take a hygienic procedure, or we are simply short, we are going to bathe the person from head to toe, a a full bath of the person. That one is the Igiene Totale. And we also have the Igiene Parziale. When we say something is partially, that means part of the body, not all the body. So we have the facial, we have the nose, we have the oral cavity, we have the teeth, we have the tongue, we have the ears, and also we have the hand, we have the male and the female intimate. So all these are Igiene Parziale. So if you are in class or during exams or class tests, you are being asked quanti tipi di igiene personale abbiamo. Abbiamo 3 tipi: totale, parziale, e speciale. When we talk about the Igiene Speciale, that one is a hygienic procedure performed by the nurses. Why do we call it speciale? Speciale because if some part of the body is being affected or is being infected, the person has some part of the body infected. So the nurses need to take that procedure by cleaning the person, because if you're an us, we don't take care of people who are infected. So everything that is infectious is being performed by the nurses. That's why we call it Igiene Speciale. So if you are being asked what is Igiene Speciale, I have a simple definition written here. So you can say trattare o prendersi cura di una parte del corpo che ha un'infezione. Trattare o prendersi cura di una parte del corpo che ha un'infezione. So if some part of the body has an infection, that's the nurses who are going to take care of that person. So that hygienic procedure is called the Igiene Speciale. So let's see some of the benefits of the Igiene Personale. Why do we do this Igiene Personale, or why do we perform hygienic procedures on some people? One, we know that we do all these things as a respect for the guest or the patient. As a respect for the guest or patient. Don't be worried if I look down on my sheet, because I have written down some points, so I will not say anything outside what I was taught in class. So I have also here information to the assist. So the person who is being assisted is a way of passing information to the person. So whilst we are performing the hygienic procedures on the person, it's a way of giving information to the person. We also have to stimulate the person's autonomy. Normally when we are taking hygienic procedures, we do involve the patient or the guest so that the person will maintain his or her autonomy. When we say autonomy, somebody who is able to do simple things like brushing teeth, putting on clothes, walking, all those kind of things, eating alone, going to the bathroom alone, all those things are there. We can say somebody is autonomous. So it's a way of stimulating the person, because you will involve the person in the procedure, so it will help you to stimulate the person's autonomy. To ensure suitable environment, if you are an us, we don't only perform hygienic procedures on the person and you just leave. If you enter a room or if you go to a guest, you make sure the environment is clean, you put things in order, you make sure the environment is serene, also the environment is cool, the temperatures are good for the person. So you must consider the environment, make sure it is suitable for the person. So to ensure suitable environment, and also to ensure safety for the patient and you the operator. Why do we say to ensure safety? We know that there are some people that have skin diseases and many kind of things. So if we perform hygienic procedures on those people, we clean them, it makes the person clean and it prevents the person from getting infectious disease. So you as an operator getting in contact with the person, you are free from getting infected because the person is clean. So it helps to protect, or it ensures the safety of the patient and also the operator. So I would like to repeat again. Igiene personale, la pulizia della persona per mantenere uno stato di benessere e prevenire alcune patologie infettive. If you can say the patologie, you can say malattie. But since this is a professional course. We are going to work with professionals, doctors, nurses, physiotherapists, surgeons, and all those kind of things. It would be better for you to use some of the terminologies. So using pathologia is very nice than using malatia, but you should decide on your own which is good for you. The most important concept is to understand what you are being taught. Okay, sometimes the grammar doesn't matter a lot. So before an OS could perform a hygienic procedures on a patient, what are some of the things you need to consider before you go to a person or before you get contact with a patient? So here, first of all, you the OS, you need to compare with the nurses to know whatever we do, we compare with the nurses because the nurses are ahead of we the us. So whatever we do, we need to compare with the nurses. You need to go to them, confront them, let us know or find out whether there are some limitations, there are some details on the person, what you should know before you go to the person, what are some of the maneuvers that you should do, what are some of the movements you should do, what are some of the things you should avoid. These are all informations that you need to gather before you go to the person. Also, after carrying out all these procedures, we must make sure that we ensure the safety of ourselves and also the patient that we are going to treat, carrying out every necessary precautions and whatever is needed. Also, we need to use our DPE. When we say DPE, that one is the Dispositivi Protettivi Individuale. When we say DPE, I find out that the English meaning is personal protective equipment. That is the PPE in English. Those are our nose masks, our hand gloves, our safety boots, our apron, all those things that we use to protect our physical body when performing any other activities. So as an us, you need to use your DPE in whatever you do. Also, we must make sure that we use our bed rails. When we talk about the bed rails, they are called sponda in Italiano. Those are the bars that have been used to cover the side of the bed so that the patient does not fall from the bed. They are very important. Also, you need to adjust the bed to your pelvic or your waist so that you are not going to, at the end, you are not going to feel back pains and all those kind of things. So these are some of the things that as an us, before you could take a hygienic procedure or before you could go on to perform your tasks, these are some of the things you need to take into measure before doing everything. Also, from there we then move on to preparing our materials, preparazione dei materiali. When you are going to perform a hygienic procedure on somebody, you need to prepare your materials after you've talked to the nurses, or when you have, in some areas we have the SCADA or the carta clinica or la consegna. You just go with your password and all those kind of things. You go and read, then you are okay with the informations. If there is nothing like this available, then you go and talk to the nurses to find out before you do everything. After that, you need to prepare your materials. As a nurse, we have something we call carrello. That is our famous carrello. The carrello is a means of transport of our materials when performing our taxes. So you'll be going to room, and also you need to take along with your materials. You can't go and come out, go in and come out, leaving patients like that. So you need to prepare every material you need on that carrello. Then you take it along with you. So the carrello è un mezzo di trasporto dei materiali che servono gli OS anche infermieri nello svolgimento della loro attività. So when the us and the infermiere people, when we are performing our activities, we need this carrello that we are going to arrange everything on it. We take them along every room, whatever we are going to perform our activities. So after preparing the material, we then move on to the preparazione dell'ambiente, preparing the environment. Preparazione dell'ambiente consists of the places that the patient or the guest occupied, the room. Before you could touch the patient, you must make sure the environment is suitable. There is enough illumination, there is enough air in the room. So you have to control if there is odor in the room. Just open the windows to make sure there is a change of air. If the room is too dark, you need to switch on the light. If the room is too cold, too hot, you need to regulate all those things to be able to have a suitable environment. Also, after we have finished preparing our ambiente, we then move on to prepare the guest or the patient. Preparazione dell'assistito. Preparazione dell'assistito. How do we prepare the patient or the assisted person or the guest? We do so by presenting ourselves. When you enter the room, after you have finished controlling whatever the environment, you have your materials, you open the windows to make sure fresh air comes in, you switch on light, you check the environment, whether there are some things you need to take care of. Before you could touch a patient, you need to take good care of everything before touching the patient, because sometimes we refer the patient as somebody who is being infected. So if you touch a patient, you just come back and switch on the light, you come back and open the windows, it's not good. So you need to take care of everything before you touch a patient. So we are going to present ourselves now. Presentazione dell'assistito. We are going to present ourselves. Maybe I am Krista and I'm here today to help you perform your personal hygiene. After everything, I have to accompany you downstairs to take your breakfast. These are some of the introduction or the presentation you are going to do. After that, you're going to explain it in Italiano. I am saying it in English so you get a clear understanding of what we do. So after that, you have to inform the patient what we are going to do. I first present myself. I'm here to help you do this, and that. Now you have to explain to the person what you are going to do. Informare la persona. You are going to inform the person, and also you are going to explain the procedures to the person what you are going to perform. Maybe I am here to help you take your bath. After that, I have to help you to put on your clothes. Also, I would like to, after that, I have to accompany you downstairs for you to go and take your breakfast. Or after that, I have to take you to the nurse for you to take your medication. So you have to explain to the person what you are going to do. After you have finished presenting, informing and explaining the procedures to the person, we then move on now to communicate with the person throughout the procedure. Involve the patient. By involving the patient or the guest, you are trying to stimulate that person's autonomy. Next time, if you go and help the person to do anything, that person will be able to do other things to help you, and you are not going to do the work alone, or you are not going to carry all the load alone. So let's see what I've written here. You must use a calm tone of voice. You must use a calm tone of voice. We know that if somebody is old, it's been associated with dementia. So as I was saying, most of the elderly people are associated with dementia, Alzheimer, and many kind of cognitive diseases. They tend to forget things early. There are some people who will be shaking. If you come close to them, they are afraid. They don't know you. So you must do everything possible for the patient to calm down and win him or her trust. So these are some of the things you need to take into consideration. By using a calm tone of voice, and also in the aspect of communication, we must consider that some patients can't see well, some of them are deaf. So in doing some things, we need to consider our pronunciation, talking slowly, and also pronouncing the word very well so that the person could hear you and know what you are going to do. So through, I would like to end everything here. So next time we are going to take it one by one and also know how to do the igiene del viso, del naso, cavorare, orecchio, all those kind of things. But before I will end, I would like to add certain small things. In doing the igiene personale, we sometimes hear some words like presidio. If your professor is teaching in class and you mention presidio, and maybe you are finding it difficult to understand what that procedure means. Procedure means there are instruments or appliances or system or substances or products that serve to diagnose, prevent or control. So procedure in my workplace, when we say procedure are those items we put on, or we put on so that the patient who is incontinent will not wet or spoil themselves. So some of these procedures are the panties, the diaper panties, and also the sleep and all those kind of things. We call them procedure. The teeth, the artificial one, we call it procedure. The 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 machine for hearing, we call it procedure. So as I was saying, procedure means many things. It depends on the content and the subject or the thing the person is talking about. That will explain the procedure. Whether the procedure is an appliance, it's a material, it's a product or substance, something that we use to prevent, or we use it to control something. Also, we will talk about the bisogni primari. We also learn something about his bisogni primari. When we say primary needs, or bisogni fisiologici, or bisogni di sopravvivenza, they are all the same. They are the primary needs. As an us, we do take care of the primary needs. What are some of the primary needs? They need to eat, need to drink, need to sleep, need to breathe, and all those things are bisogni primary. So before a person could be given medication, a person could be shown love, a person can socialize, a person can be self-sufficient, we need to satisfy the bisogni primary before the person could be able to reach the other needs. So you also study something about the bisogni dei primari, piramide dei bisogni di Maslow. Piramide dei bisogni di Maslow. So Maslow is somebody that discovered that pyramid, that a person's needs to go into 5 stages. One of the stages is the bisogni primari, that we the horses we occupy that needs. So if you are taking the course already, you will be learning something about the bisogni primari. And also you also learn something about the salute della persona. When we say somebody is healthy, it talks about the complete physical, mental, and social well-being. It doesn't mean the absence of diseases alone, but somebody can be ill but have a complete physical, mental, and social well-being. So somebody who is physically, mentally, and socially good and stable, that's what we call a person is what? Healthy. So I learned you will be you'll be highlighted on that part too. We also learn something about the factors that influence the need for hygienic. There are some things that sometimes prevent the patient or the guest to take hygienic procedures. What are some of these things? We know that psychologically, we the operators, sometimes we don't work on ourselves and we are being depressed and we are emotionally depressed, and also sometimes we approach these patients incorrectly, and all those things can also make them refuse to be taken care of. Also, we have religious factors, culture and religious factors. When it comes to cultural and religious factors, we know there are some people, when we are performing hygienic procedures on them, it's very difficult, especially we know our brothers who are Muslims and all those kind of things. There are many precautions. That's why it is important that before you go and take care of a person, you need to confront the nurses to know the details about the person, so you will also prepare to confront that. We also have individual factors like age. The person is old, doesn't understand things very well. The gender, the person is male, I am a female, I'm going to intimate, or I'm going to see that person's private part, and it's not good. Maybe the person will feel shy or all those kind of things. So we will also be talking about some things like this, factors that influence the need for hygienic. So Thank you all for watching my video today. I hope you like whatever I discussed today. If there are any mistakes or there are some things I couldn't say very well, you can feel free to correct me. If there are some topics you would like me to treat or questions you would like to ask me, you can feel free to ask. See you next time in my videos. Bye bye.